Hi, everyone. Welcome to our Spotlight session. We are excited that you've decided to get the inside scoop on how to join our ICES research community. Thank you again for joining us today. First, a few housekeeping notes. A reminder that the sessions are live and being recorded. Video recordings will be available after the conference. And we encourage you to get involved in the conversation. We want to see your comments and questions, so please feel free to use the chat and Q&A feature in Zoom. You are going to hear from several speakers in the session. I will start us off. I'm Brittany Lee, the site lead analyst for ICES Western. We can bring up the slides now. Okay, you can go to the next slide. We will begin our session with an overview of ICES. Why should you join our research community? Who are we? What do we do? And what do we offer to our researchers? Next, we will go through several pathways to obtaining an ICES affiliation. Specifically, what does it mean to be an adjunct scientist, a postdoctoral trainee, fellow, or an ICES student? And what are the application processes? We will also outline how to conduct research at ICES. We will touch on project process, project costs, our data repository, data access, and analytic platforms. We also have extensive resources available for project guidance, and we will highlight some of those. After our presentation, we are happy to answer any questions that you may have. Okay, next slide, please. Who we are. We are an independent, not-for-profit research institute founded in 1992, and we have conducted a multitude of studies every year since. ICES evaluates healthcare services, providing timely, unbiased evidence within a broad range of topics, such as cancer, diabetes, kidney disease, primary care. The list is extensive, and those are just to name a few, but our focus is on promoting effective and efficient and equitable healthcare. As a prescribed entity under Ontario's Personal Health Information Protection Act and the Coroners Act, ICES is a trusted steward of health records for over 20 million Ontarians, including day-to-day interactions for past and present users of our healthcare system. To our province-wide community of researchers, a network of over 900 scientists, trainees, students, and staff, we offer secure access to an array of large, linkable, and coded health-related databases. These extensive data holdings at ICES are used to inform decision and policy on effective and efficient healthcare delivery. Data is the foundation for everything we do. So with this access, we are committed to its protection, maintaining its privacy, confidentiality, and security. Next slide, please. So the ICES network consists of 7 sites across Ontario, each representing satellite partnerships with leading research institutions, and each serving to expand the capacity of ICES to conduct research across Ontario. Beyond our central location at Sunnybrook Health Sciences Centre in Toronto, sites offer opportunities to work with local expertise and collaborate with local researchers, increasing the breadth of scientific knowledge available in our community. Although sites differ in physical location, there are no significant differences in project processes. Each site has direct network access to ICES data holdings and all ICES analytic resources and tools. With regards to study topics and disciplines, ICES research activities are organized into 8 research programs across Ontario, and these are shown here on the right. Each program is a hub for content-specific collaboration and networking, while fostering strategic partnerships and providing resources and administrative support within these specific research streams. Next slide, please. At ICES, we support researchers, students, organizations, and policymakers through 3 research and analytic streams. The first stream is investigator-initiated research. This covers studies led by ICES scientists, postdoctoral trainees, fellows, and students, alongside the support of ICES staff. These projects are conducted through one of our 8 research programs and are usually funded by peer-reviewed sources. Next, recognizing that enhanced data access can further our impact on the healthcare system, ICES Data Analytics Services, also known as DAS, can be used to administer third-party research. This research gives non-ICES researchers virtual access to ICES data and may be funded by either private or public sector. As well, policymakers or providers can initiate applied health research question projects, which are funded by the Ministry of Health. These projects are used to obtain evidence to answer specific questions in order to inform planning, policy, program development, or service delivery decisions. These can be administered through DAS as well. Next slide, please. Next slide, please. What we offer. So as I touched on earlier, we offer data. We have access to over 100 ICES data holdings representing 18 billion individual records, capturing healthcare system use both over time and across Ontario. The ICES data repository includes health administrative data sets, demographic data sets, population-based surveys, disease registries, validated chronic condition cohorts, electronic medical records, and a growing number of other non-health administrative data. But our power really comes from the ability to link these data sets through common identifiers. We can link demographic data with administrative data, survey data, registries, and even your project-specific data. We also have a wide range of services, resources, and tools available to you as you initiate and conduct your research. These include public and community engagement and knowledge translation support, grant consultations, analytic resources and tools such as methodology guides, a concept dictionary, programming tools, including macros and scripts. We also offer mentorship and training, which involves the mentorship of new scientists, trainees, and students. And I'm going to insert a plug here for the Faculty Scholars Program offered at ICS Western. We also offer orientation and training on ICS analytic environments and data holdings, research program meetings for collaboration, and regular scientific rounds. Most importantly, though, we offer our expertise, our people, a community of research, data, and clinical experts, privacy and information security specialists. Our world-class research teams are really what is at the heart of our work and what enable ICS's ongoing innovation and impact on healthcare. Now I will pass it off on to Melissa.
Great. Thank you so much, Brittany, and good morning, everyone. So I'm Melissa Stamplakowski, and I work with the ICS Science Office, and part of our role is supporting some of the appointments that we'll be talking about this morning. So as Brittany noted in one of the previous slides, this session is really focused on individuals who would like to conduct investigator-initiated projects as an affiliated ICS researcher. So the next few slides will cover some of these key pathways that individuals can take to gain an ICS affiliation. So next slide, please. So firstly, independent researchers who have already had experience working on ICS projects or working with similar administrative data, who want to build their program of research further using ICS data, and who are interested in opportunities to contribute to and collaborate with others as part of the ICS network, might want to consider applying for an adjunct scientist appointment. The second stream that's noted here is for academic researchers, such as postdoctoral fellows, who want to gain more experience with ICS data and analytics through a more time-limited appointment that grants them access to ICS data to conduct their own analyses in support of their postdoctoral or fellowship work. And the third pathway noted here is for graduate students who require ICS data to fulfill the academic requirements of a course, practicum, or thesis. So once affiliated, it's actually quite common to see people move across these categories as they progress in their research careers. So for example, many of our scientists started their ICS journey as students, fellows, or postdoctoral trainees. And in some cases, some scientists have even started as staff, which has really helped them provide them with experience and training to help them advance their programs of research using ICS data. So one note is that all streams do require that the individual work with a full status ICS scientist whose research interests align with those of the applicant and who will act as the ICS mentor or supervisor over the course of their ICS term. You can find ICS scientist profiles, which include their research interests, research program and site, as well as note on whether they are a full status scientist or not on the ICS website, and this information is fully searchable on the website. And just to add, researchers who do not meet one of these criteria or individuals who may be working their way towards meeting one of these criteria can still participate in ICS projects. As an ICS collaborating researcher, they can act as a principal investigator or PI or co-investigator on projects, but they do also must work with a full status ICS scientist who will take responsibility for and oversee the project to ensure it is conducted in accordance with our policies and procedures. Please also note that ICS collaborating researchers are not given access to ICS data to conduct their own analyses. Next slide, please. So looking at adjunct scientist appointments. So once appointed, the initial term is for an up to 3-year probationary period, during which the ICES mentor will be very closely involved in all of the scientist projects to provide support and guidance. Thereafter, upon meeting the criteria for a promotion to full status, adjunct appointments are then reviewed every 3 years. So it is important to note that scientists are not routinely provided with access to ICES data to conduct their analyses. Rather, they will work with ICES staff members who will support the analytic needs of the project. And Farhana will be speaking to this data access in a bit more detail later on. So initial adjunct appointments are contingent upon several criteria that must be satisfied at the time of application. The first of these is an Ontario University academic appointment at the level of assistant professor or higher. This is so that the scientist, once they become full status, will be able to independently supervise ICES students and to help contribute to ICES's important role as a training environment. In addition, experience working with ICES or similar administrative data from other jurisdictions, which is demonstrated through the use of these data in at least 2 first or senior authored papers, is also required. The applicant also needs to demonstrate that they have the funds available to conduct their proposed ICES program of research. So these funding sources can include departmental funds or grants, including either grants that they themselves hold as the PI or those on which they are named as a collaborator. And then finally, and this last criterion applies to any individual who is affiliated with ICES, including staff, the applicant cannot have any unmanageable conflicts of interest or COIs. ICES has a robust COI policy framework in place to help maintain the transparency and trust of our organization. And any COIs declared at the time of application or at any time during the appointment will be assessed by ICES's COI committee. So the ICES website has a link to our COI policy and related FAQs, including information on what are and are not considered allowable activities under this framework and related remuneration considerations. Next slide, please. So turning to postdoctoral trainee, fellow, and visiting scholar appointments. All 3 of these appointments are term limited, ranging from 1 to 4 years in total, that give these researchers access to ICES data to conduct their own analyses if required. So in general, looking at fellows, these are researchers who are interested in becoming ICES scientists, but they may not have yet accumulated the experience needed to qualify them for a scientist appointment. So many ICES fellows have used this appointment opportunity to gain familiarity with ICES data, methods, policies, and procedures, and then with the publications arising from their ICES fellow project work being used to support subsequent successful adjunct scientist applications. So the second category here are postdoctoral trainees, who are generally post-PhD researchers who use this ICES appointment to further advance their training using ICES data. And these appointments generally end once their postdoctoral fellowship and funding ends. University appointments are not required of postdoctoral trainees or fellows, but they are required of visiting scholars, who are usually based outside of Canada and come to ICES for a 1-year appointment, where they collaborate with others in the ICES community to share knowledge and expertise. Next slide, please. And then finally, looking at our last category of an ICES student. So these are individuals who are enrolled in a graduate program and who require access to ICES data to complete the course, practicum, or thesis requirements of their degree. ICES student terms range from 1 to 5 years in order to give these individuals sufficient time to fulfill their academic requirements, as well as to submit their research for peer-reviewed publication. Like other appointments already mentioned, ICES students require a full status ICES scientist to act as the ICES supervisor on their project. However, and this may be important to some of you attending today, the student's primary thesis supervisor does not need to be an ICES scientist. However, the ICES scientist who will be acting in the supervisor capacity for the purposes of the ICES project should be a member of the student's thesis committee. And we do encourage students and their supervisors to connect with the relevant ICES research program or site early on as they're planning their research. And we do recommend that this is at least 3 months before the anticipated project start date. Given the usually tight timelines around student research and deliverables, early submission is important to get the student onboarded so that they can access the ICES intranet and resources. And early application also helps to facilitate staff allocation to the project. And just a final note to add, ICES is not a degree granting institution, so we don't directly admit students or offer coursework, and we don't evaluate the coursework or degrees of other institutions. So questions related to these requirements should instead be directed to the relevant university. Next slide, please. So this slide just summarizes the application documents that are required for each of the affiliations that have been covered today. Application forms, which are generally quite brief, just 1 to 2 pages, are required of all roles, and they ask about things like the applicant's administrative and funding source information. All applicants must provide a brief outline of their ICS research plans, or in the case of students, a 1 to 2 page project proposal. As previously mentioned, they must also submit a completed conflict of interest form with any declarations then reviewed by ICS's COI committee. Scientists, postdoctoral trainee, fellow, and visiting scholar applicants also need to include a copy of their CV with grants and publications involving ICS data, or those data similar to ICS, highlighted, in addition to providing a letter of support from their ICS mentor. Applicants who are planning to work out of a non-ICS central site must also demonstrate support from the relevant ICS site director. And finally, postdoctoral trainees, fellows, and students must submit a document called a Project Activation Worksheet, or PAW. So we do really like our acronyms at ICS, and this is one of the many that we do use. And this is the document that's used to kick off the financial activation of a project, and it really helps to get things moving ahead with the project. Full details around each of these different application streams are available on the ICS website under our Join Our Research Community pages. And these pages also include links to the relevant documents, such as application forms and the COI policy, as well as contact information for who you can reach out to at either the ICS Central Research Program you want to work with or at the sites. And so with that, I will pass things over to Farhana, who will speak to conducting research at ICS.
Hi, everyone. My name is Farhana Khan, and I'm the Interim Research Director for the Research and Analysis Department. And today I'll be walking you through key aspects of conducting investigator-initiated research through research and analysis. So this really excludes our third-party research. Next slide. Next slide. Perfect, thank you. So research at ICS is initiated through an ICS project, as Melissa mentioned, and each project moves through different stages, and each stage is accompanied by varying levels of support from ICS. And so a project typically starts out at the grant intake stage, which is an opportunity for researchers to have their grant proposals reviewed in terms of scope and ICS budget. At this stage, ICS will provide a letter of support. So it's a really good opportunity for ICS to weigh in on the budget in terms of you might want to ask for more in the grant, or we'll say that we'll sign off that the grant is sufficient to cover the work in the research proposal. So once the grant is successful, the researcher would then get in touch with our program lead and program coordinator to initiate the actual project. And so some projects will involve collecting or transferring data to ICS, which I will talk about later in the presentation. So the next few phases on this diagram, if we can go back one slide, thank you. So the next few phases or key steps also involve submitting a proposal, the budget or the project activation worksheet or PAW that Melissa mentioned, as well as a project privacy impact assessment form, which we call a PIA. And so the PIA actually outlines the purpose and the objectives of the project, as well as the data sets that the researcher plans to use in the analysis. So as Melissa mentioned, it's really important to be onboarded quickly so that you have access to our resources, that you can look into what data sets would be suitable for your project. So once all of these forms are approved, the researcher would need to submit a data set creation plan, or what others would call an analysis plan. And then once we have this analysis plan, we assign an analyst to the project itself, and then we have a kickoff meeting. And so at this kickoff meeting, we review the analytical plan in more detail, but also go over timelines and responsibilities with the entire project team. And then following the kickoff meeting, we move into the analytic phase where the analyst actually prepares the cohort and the requested outputs. For an ICS student project, the analyst will prepare the cohort and post it onto the student project file, and then the student will actually complete their analysis if it's part of their project. So once the project team has all of their outputs, they will draft the manuscript and work towards getting the results published. And so we also have epidemiologists who can support preparing the analysis plan or the manuscript itself if the team would like this service. At each stage of the project lifecycle, we remind everyone that it does require some planning and time. The longest stage is the analytic phase, especially because it really is an iterative process between the project team and the analysis, and it all depends on the complexity and the scope of the project itself. So to create a simple cohort with a very clear analysis plan, timelines would typically be around 3 to 4 months. And it can be longer if there are special data involved, which may require data sharing agreements, or if the project is complex and needs clarification or a deeper dive into the data itself. Next slide. So as I mentioned, projects require planning and time to complete. They also require funding. So the minimum cost for a project is $7,500. And so that's really for a very raw data set for maybe a student project where the student has advanced analytic skills and would want to do most of the work in the analysis or further enhancing the data set itself. So the average student project that involves a cohort cut and where the student completes the analysis will cost around $20,000, and this equates to 137 hours of analyst support. So it is quite a bit of work involved. And then the average project that has a clearly defined cohort and a few outcomes included in the analysis will cost around $39,000, which will equate to 273 hours of analyst support. So those are our typical projects, say a cancer project that has a bit of complex variables that will look at maybe survival analysis. So that's the average project that we're looking at there. And then the project and the budget is contingent on the complexity and the scope of the data analysis plan, and the budget will be revised as the scope changes throughout the course of the project. So it is not a fixed budget. It really depends on what the investigator would like to do. And so we will modify based on the funds available, and we'll modify the scope to align with the funds available. Next slide. And so at ICES, we have a few different types of data. We have our ICES data holdings, which are primarily our administrative data that we have in-house. And most of these data sets are available for use for all projects. However, some of them also require special permission to use. We also have imported data that we refer to as project-specific data, and these require data sharing agreements before we can bring in the data and actually use it. These data are brought into ICES for the purpose of a single project or a group of projects to use. And these data can be collected through primary data collection at ICES. So an example of that would be conducting a hospital chart abstraction study. So if it's say a cancer project and the investigator wanted more complete information on tumor stage because our administrative data was missing that information, that's where you would conduct like a hospital chart abstraction study. The other method of bringing in data is through transferring third-party data to ICES, and an example of this would be to transfer data collected through a research study or a survey conducted outside of ICES. Next slide. And so as the previous speakers have mentioned, we have a very large core data repository at ICES, over 100 different data sets covering different areas of the healthcare system, geography and diseases, and they are all de-identified and linkable. So in each data set, individuals are uniquely identified by their ICS key number, or what we call an ICAN, which is an encrypted form of their health card number. So ICANs can be found on most individual level data sets, allowing linkage across multiple data sets to define conditions and utilization of the healthcare system. Our data holdings can also be linked to external data that is brought into ICS. Next slide. And so at ICS, we have different analytic environments and levels of data access. All of the work on the project data set must be done within our analytic environments. So the first one is our research analytic environment, or what we call the RAE. And this is available remotely as well as on site. On this platform, we use SAS as our main analytic software, and R is also available. And then we have a high computing performance environment, which we typically call our data safe haven, or DSH. We no longer use the longer term called HIDAP, if some of you have heard of that before. And so this environment is also available remotely. And then the analytic software on the DSH includes R, RStudio, Python, Anaconda, Jupyter Notebook. So we do not use SAS on this environment. I will note that we have a third analytic environment that is remote called IDAVE, which is available for our third-party researchers who receive a risk-reduced data set. Next slide. So ICS has different access levels for ICS data holdings and are based on different roles. And so as an ICS student or trainee, you would have access to a prepared data set or cohort, which would allow you to conduct your own analysis. And so this means you wouldn't have direct access to the data repository. Instead, you would work with the analyst who would pull the data for you. So they'd create the cohort and pull additional variables. ICS students and trainees do not have the ability to transfer summary data from the analytic environment directly. And so how this works is that you would work with the analyst who would assist you with these requests. The analyst would actually vet the output to ensure there's no small cells are included in the output, and then share the files with the student or the trainee. And so ICS scientists are not routinely provided access to individual level data for their ICS projects and are approved case by case for a 1-year term. So some of the requirements for this type of access would require the ICS scientists to assume responsibility for developing and leading the execution of the analytic plan for their specific project. They must have analytic experience and must abide by ICS policies and procedures as well. So the ICS scientists would not have direct access to the data repository similar to the students and trainees. They would be provided with a prepared data set to work with. So in all of these scenarios, the student, trainee, and scientist would only have access to their project where they are listed as a principal investigator. So you can't have access to other individuals' projects to kind of help them out. So it doesn't really work that way. Next slide. Okay, and so this table here goes a little more granular. Essentially, we have 8 different levels of data access, and they're based, again, on the role and the type of identifiers included in the data set. So level 4 data, you can see at the bottom, is the most risk-reduced data that's available. That is typically provided to our third-party researchers. And then so if we look at the table, you can see that students and trainees would have access to levels 1.5 through level 3 data. And so our default for students and trainees is actually level 3 data, where we remove the date of birth and postal codes. And so what we do here instead is we replace all of the dates and convert them into the number of days or the distance from a specific location if that's what's needed in the analysis. So all other levels would need to be requested and approved case by case. Next slide. And so, and finally, the big question is often how and where can you access the data itself as an ICS student or trainee? Well, access is available within Ontario, and it's available remotely. And we also do now currently offer remote access from Canada, the US, UK, Australia, and New Zealand. However, if your data set involves the use of the Canadian Community Health Survey, so CCHS data, or the National Population Health Survey, NPHS data, you can only access the project data set from one of ICS sites, meaning you have to be on site and remote access is currently not permissible. And so if access is actually required outside of these countries listed here, the requests are reviewed, and if approved, they do require additional technical requirements as well as costs annually, so to support the out-of-country access, and not all countries are approved. So one thing to note is that access to the data for ICS staff is currently limited to within Ontario. Next slide. Next slide. Thank you. So switching gears a little bit, how does ICS support project teams and researchers to efficiently complete their project? Well, aside from working from highly skilled analysts, epidemiologists, and methodologists, we have a lot of internal resources that can be accessed remotely through our internet page. And so once you're onboarded, we allow access. And this first example is just our data dictionary. And this includes a lot of details around the variables in the data set, additional information about updates and special considerations when using the data. And it also outlines all of our data obligations, such as permissions for use or acknowledgements that must be included in the manuscript. So we do have an external facing data dictionary as well, but has limited information. So the internal one is very robust compared to the one that we share externally. Next slide. And then this table here outlines additional resources that can be accessed. So we've got a ton of guides on different methodologies. I believe we're close to 60, if not a little over 60 methodology guides. And then we've got recording of past presentations that were, that the scope involved different methods or data sets. We've got a large number of macros and scripts that are available, as well as commonly used definitions or concepts that can be easily incorporated into your analytic plan or into your analysis as well. So we are well known for our macros, and it's sort of kind of plug and play with when you're actually writing the code. And so now I'll pass it back to Melissa.
Hannah, so if we could go to the next slide, please. So as Farhana noted, ICES offers many resources and services that support our researchers throughout the entire life cycle of your project. So I will just highlight a few more in addition to what Farhana has already discussed. So first is the Indigenous Partnerships Data and Analytics Department at ICES is integral to all projects involving the use of Indigenous data or identifiers. ICES has developed and continues to build strong partnerships with First Nations, Inuit, and Métis communities and leadership organizations, as well as urban Indigenous health service providers, with community engagement forming the foundation to this work. So it's crucial for researchers to connect with this team if their project is planning to include identifiers of an Indigenous population from any ICES dataset, so that they can discuss the community engagement and/or approvals that may be required for the use of these data. Second, it's imperative that all work involving race and related data, which includes data on race, ethnicity, immigration, or other related variables, upholds anti-racist approaches that promote health equity. ICES has developed a guidance document and framework for anti-racist approaches to research and analytics at ICES. And this includes key considerations and guidance for project teams to consider when using these data. And this report is available on the ICES website. The ICES Public and Community Engagement and Knowledge Translation team has led the development of many other resources for anti-racist research, in addition to offering training and consultation opportunities for our researchers. A guidance document and consultation opportunities are also available to help support researchers who may be planning on reporting on information at the provider level, such as that at the level of healthcare facility or physician group. Next slide, please. So in addition to the resources discussed on the previous slide, the ICES Public and Community Engagement and Knowledge Translation team is always ready to support researchers in a number of other ways. So their intranet resource library includes resources, guides, tools, and trainings that are dedicated to integrated knowledge translation, how to engage the public and patients in research, and community engagement. Researchers can also bring project-specific questions or concerns to ICES's Public Advisory Council, or PAC or PAC, to obtain their perspectives. The ICES PAC is a diverse group of public representatives who have been convened from across Ontario to help guide the organization and its researchers. And the ICES team is also available to provide personalized advice to researchers through their one-to-one consultation services. And so now with that overview of ICES, we will conclude our actual presentation and we'll now move on to the discussion and Q&A part of our session. Thank you.
So I can see from the Q&A, we've got one question. And so I think, Melissa, this is for you. Do scientists applying for an adjunct appointment need to already have 2 ICES publications as first or senior author before applying, or as a probationary condition to retain the appointment in the following 3 years?
Great question. So yes, these applications do need to note that there have been at least 2 papers already published using ICES data or data from similar jurisdictions. And this is just to demonstrate familiarity with use of administrative data so that the scientist is able to come on board and begin their projects very early on. And then once they do become appointed as an adjunct, then it is a condition of promotion to full status that they also meet certain criteria to fulfill that promotion. And that also includes additional publications at that time involving the use of ICES data as a senior or lead author. But in that situation, papers that are currently under review can be considered. But yes, for the initial application, we do require the 2 publications. Okay, so we do have another question in the Q&A. So maybe this is a great question to pass to Brittany and Jen. So the question is, are there any plans to expand the satellite sites to other locations within Ontario?
So I'm Jen Fleming. I'm the site director at ICES Queens. As far as I know, there are no current plans. But if there are individuals who are interested in working within ICES and are at an academic institution which doesn't currently have an ICES site, you can always contact individuals at the sites and potentially be able to conduct research under the supervision of an ICES scientist as a collaborating scientist. And so that happens, I think, quite a lot throughout the network, where there's different individuals who are at different sites who might not have the ICES site at their institution, but you could still be able to perform research.
Okay, we have another question. Maybe I'll put this one to Melissa. To prepare a DCP, PIA, and PA, it seems intranet access would be very helpful. One needs an appointment first, though, correct?
Yes, so thank you, Farhana. That is correct. So this is why in the case of students and trainees, we do like to get them onboarded as early as possible, which is why we want to get them started very early on before they're planning their projects so that we can actually get them early access to doing those, to having access to those documents so that they can actually review the data dictionary, all the different resources we discussed to help prepare their project initiation documents. So another incentive to get people onboarded as soon as possible in the case of students and trainees. For scientists, though, we do require that they be appointed as a scientist first. So to go through that appointment process to be given intranet access. Given the intranet it does contain a lot of confidential ICS information, especially around the data sets, we do need to make sure that people are appropriately trained and onboarded with an account before they can access that. Okay, so we're seeing some more questions. So the next one, so maybe for Hannah, I'll pass this over to you. Why is remote access only allowed in some countries and not others? For example, France.
Okay, so based on our cybersecurity assessments and guidelines, it was deemed that we have very similar practices in Canada and the 5 countries, or the 4 other countries that were listed, and ICS currently is comfortable allowing at those countries right now. And so if access is required from other countries, a whole assessment is done on the practices around cybersecurity and access and data obligations as well come into a factor. And so it's not that other countries are not allowed, it's just we have to properly and thoroughly assess them. Okay, so I'll take the next question. Are there ongoing discussions with StatsCan to regain remote access to CCHS? So I can answer this one as well. We are always in continued conversations with Stats Canada around our access. And so we haven't heard any updates in changing the requirements to be on site. As soon as that changes, we'll all be excited because we do require staff to go in when they're using the data set. So as of right now, there has been no change, but we are in continued conversation with Stats Canada.
Okay, and so I think I'll take the next question. So the question is, how might we suggest new graduates entering the workforce begin getting involved in ICS? So that's a great question. So I think for academic researchers, so people who are beginning their careers who may not have been involved in ICS projects, it might be a great opportunity to reach out to some scientists who may have similar research interests to perhaps become collaborators on some of their projects if you want to learn more about ICS data projects as well. So we did discuss some of the streams around official ICS students and trainees, but many scientists also include medical residents, other early career researchers as part of their collaborating project team to be involved in those projects as well, just to provide mentorship and guidance too for people who may be early on in their careers. So that's one opportunity. I don't know if anyone else on the panel has any other suggestions or that they would like to share.
I mean, I can comment. I've helped to mentor quite a few people through this process. I think the main thing is to try and identify an ICS scientist where you align with your research topic and reach out to them to see if they have the ability to help mentor you through this project. Or if you know of a team who's already doing some work, you could always reach out to them to see if there would be potential for you to get involved with their research project as a collaborating scientists. And so through this process, you can mentor lots of different types of individuals. So undergraduate students, medical students, as Melissa said, you don't necessarily have to have your first academic appointment to be a collaborating researcher and start learning about ICES and how you might be able to leverage the ICES data for your own future research program.
I would just like to add that depending on how you would like to get involved, we also have a list of current opportunities could be available, and you could visit the career section of our website if that's what you mean by entering the workforce.
And just to add, and maybe for Hannah, I will take this other question too. We have a new question that came up that asks about ICES scientist profiles on the website, whether they're grouped by theme or expertise to facilitate link ups. And so that's also another good opportunity in terms of when Jen was suggesting looking for someone who aligns your research interests. So we do have 300 plus scientists right now. Right now, they are arranged through some key research themes, and they are arranged within the programs. So they are grouped that way on the website, and it is fully searchable. So what we really do suggest just digging in, looking for different topics, looking for different areas, looking for different scientists across the network who might align. And then there is a feature where you can also reach out to them that way through the website.